Scotiabank has pledged continued support to the fight against HIV and AIDS. Country Manager Philip Cross, speaking at the bank-sponsored launch of Regional Testing Day, said the event is the largest philanthropic activity undertaken by the financial institution, with 30 branches in 20 countries participating.
Scotiabank remains steadfast in our commitment to fighting HIV and the associated stigma and the discrimination that too often can prevent people from getting tested, knowing their status, obtaining treatment, and the care they need for themselves, their families, and others. It is for precisely this reason that we are partnered with the Caribbean Broadcast Media Partnership in the first place. We wanted to help destigmatize HIV testing so that there's nothing to fear and that getting to know your status should be something as simple and as routine as withdrawing cash from one of our ATMs here at Scotiabank. Regional Testing Day is a part of Scotiabank's overall global commitment to fight HIV and AIDS, a commitment which from the start has been inspired and led from here in the Caribbean. 10 years ago, Scotiabank established a mandate to promote HIV and AIDS prevention and education in the Caribbean. We recognize the need to do so as a region, as this region has the second highest endemic prevalence of HIV and AIDS after Africa. Quite frankly, we knew that was a problem for all of us, everyone. And if something affects the communities in which we live and work, then as a company, it is both our corporate and social responsibility to help fix this problem.
For St. Lucia, the fight against the deadly disease has seen some positive results. In the last 5 years, the island has achieved zero mother-to-child transmission. Since 1985, there have been 1,032 confirmed cases of HIV AIDS. Dr. Lucia Eugene is the Senior Medical Officer for Infectious Diseases.
That from the introduction of antiretroviral therapy in 2006, we have had a decrease in the number of deaths. Before 2006, that is before the introduction of antiretroviral therapy, we had 286 deaths due to HIV. After 2006, or after the introduction of antiretroviral therapy, we have a decrease from 286 now to 68. That shows a reduction of 21.2% in deaths. So hence, data collection is very important.
Recognizing the efforts of the global community, Prime Minister Dr. Kenny Anthony reminded local and regional agencies that the war is far from over.
Unquestionably, a redoubling of effort is needed. We have become complacent, lulled into a sense of insecurity, primarily by the advance of medical science. In the fast-ensuing post-2015 era, our cause will require greater dedication, not less. In the next few months, the world will confirm the new Sustainable Development Goals. That is a new framework for the next 15 years. We will globally commit to an end, I repeat, an end to HIV and AIDS in this world by 2030. This is an ambitious target, but it is certainly possible. Days like today can help to make the difference. Partners like the ones who have come together in St. Lucia today help to make that difference. People who know their status help to make that difference.
Speaking to the personal responsibility of all in eradicating the disease, Prime Minister Anthony noted contributing ills of promiscuity and prostitution.
Because prostitution is more hidden than seen on the streets or at bars. It is often cloaked deep within our communities, in our homes, in our offices. It is therefore clear that we all have to come together simply because this affects all of us directly or indirectly in one way or another. Today, we reaffirm the need to come together to break the stigma around testing. There ought to be no shame in getting tested, but yet we are afraid to do so. Let's break the emotional chains that imprison us and put us in fear. The politician ought to get tested. There ought to be no shame or question in that. The church congregation can get tested. So too can the pastor or priest, the company staff, from CEO to clerical assistant to cleaner. If we want to end HIV and AIDS, we need to have a country where everyone gets tested.
Meantime, the leader of the opposition, Dr. Gail Rigobert, highlighted the impact HIV and AIDS has had and continues to have on the economy and the development of nations.
Not only the human cost or the emotional cost, but the stories of the countries in Africa where HIV/AIDS aids into their productive sector is a ready reminder that HIV/AIDS is also an economic issue of concern. I wish to commend the partners, the stakeholders who continue in their fight to ensure that we correct the behavioral patterns that give rise to the imprudence that breeds those kinds of diseases. That we are reminded that we are to exercise responsibility in our private lives as much as we are reminded to do so professionally as well. Let us not forget that whereas we can boast of having made significant strides in lifting the stigma associated with HIV/AIDS, there is some distance for us to go still.